Hi, everyone. We are very excited to have you all with us today for CurePSP's quarterly Ask the Expert webinar. I'm Jessica Shore. I am the Director of Clinical Affairs and Advocacy here at CurePSP, and it is a privilege to be moderating this program. Today, our expert is clinical social worker Adriana Gonzalez, who will be discussing the very important topic of advanced care planning for people with progressive supranuclear palsy, corticobasal degeneration, and multiple system atrophy. A few housekeeping items before we get started, though. This program will be about an hour long, including both Adriana's presentation and the question and answer session. Adriana has agreed to share a copy of her slides with registrants. Her slides and a link to the recording of this webinar will be provided in a follow-up email to those who had registered. So please be on the lookout for further communication. This webinar will also be archived on our website, on Facebook, and our YouTube channel for anyone to view later on. Adriana will likely address many of your questions throughout her presentation, and realistically, we're never able to get to everyone's questions, but if you would like to share a question, you're welcome to type it in the comment section of the platform that you're using to watch this live. We also have the questions that many of you submitted when you registered, so we'll be referring to those. You can also use the comment box to say hi and where you're tuning in from if you'd like to. Please know that this webinar and Adriana's presentation and responses to questions are not medical advice. We recommend not sharing personal health information in the comments, and we encourage you to talk to your healthcare team if you have medical questions or concerns. At this time, I would like to introduce our speaker for today's Ask the Expert webinar. I'll wait till she's on there. We have Adriana. Hey, Adriana. Adriana Gonzalez is a clinical social worker at the Parkinson and Other Movement Disorders Center at the University of California, San Diego, which is one of CurePSP's Centers of Care. At her center, she is part of the Palliative Clinic, developed a Latino outreach program, and works with support groups and community organizations to provide education about movement disorders, including Parkinson's, PSP, CBD, and MSA. Adriana is a strong advocate for supporting people living with these diagnoses and maintaining their quality of life throughout their disease journey from diagnosis through advancing disease. And I'll share that I have known Adriana for several years from my life before joining the team here at CurePSP, where we had collaborated on several projects related to palliative care and social work for people with Parkinson's. And it has been a joy to get to continue to work with her as I transitioned over to my career here at CurePSP almost a year ago. She is actually on our patient and care partner advocacy committee here at CurePSP, and she co-facilitates our newest support group, which is called Flying Solo, which is for people with PSP, CBD, and MSA who live alone or who do not have a clearly designated care partner. And I have asked her here to break down advanced care directives for us, as they are important tools for sharing wishes for medical care and quality of life with our families and healthcare teams. Adriana, welcome. Thank you for being with us today. I'll let you take it from here.
Thank you for that introduction, and thank you to CurePSP for having me, and to all of you for tuning in. I know that talking about healthcare decisions and advanced care planning isn't the funnest topic, isn't usually the first thing that we want to talk about, but it's so incredibly important, and so I'm happy to break it down a little bit today, answer some questions about how to start, and hopefully be a resource to you all. And so I really think about we're navigating future healthcare decisions and when we talk about advanced care planning. And it's something that I always encourage my families to talk about and think about. And even for those of us who might not be living with a chronic health condition, it's important to think about in an emergency situation, what would I want my family to know? And so my objectives for today I'm going to define advanced health care directives. A lot of people sometimes get confused about what they can do on their own, what they might need an attorney for, like estate planning, and what advanced healthcare directives might include, and also provide some strategies to document your wishes. This feels sometimes like a really big task, but if we break it down piece by piece, it can feel a little bit easier to do. And so, what are advanced healthcare directives? They are legal documents and they're outlining our treatment preferences. It empowers us and allows us to outline our future care decisions, including medical treatment. It's effective when someone no longer has capacity or in the event of an emergency. And by documenting our wishes, our loved ones have clear information, which reduces decision making burden. I think it's really important. I think a lot of us learned during the pandemic that we don't know what's around the corner or what types of situations we might be faced with that impact our health. And so, having these documents in place can really help our family navigate the healthcare system on our behalf. And so, I wanted to break it down just by giving a step by step guide. And the first step is what we're doing right now, which is initiating the conversation, being curious about, well, what is an advanced healthcare directive? And if you already have one, when did I complete it? And does it still relate to my health and my wishes now? And throughout our step by step guide, we're going to go through the different ways that we start exploring what's important to us, considering our values. I'm going to encourage you to complete your advanced healthcare directive and to talk to your loved ones about the decisions that you documented in your directive. That can be a difficult point. Always have copies of them and then take physical copies to your next medical appointment so it can be in your medical record. I don't expect you all to, at the end of this, have it all figured out and filled out and have it ready tomorrow for your doctor, because it is a process that takes time to think through what's important. And so right now we're going to focus on initiating this conversation so that you have the tools to go on to the next step. So when we do that, we start by gathering information, which is what we're doing today. Education through webinars, research, talking with your medical team. That really is going to have a lot of input into what we're putting down on our advanced healthcare directive. Because if we don't know how our condition what it might look like in the future, or what types of decisions we might need to make, then how do we document that? So we start there. Let's get some information. Let's ask our team. Let's figure out what types of decisions might my loved ones be faced with. And then exploring our wishes and values. That one takes a little bit of work just in thinking through, well, what's important to me? What do I value? What do I consider quality of life? And how can I define that for my family members who may in the future have to make decisions for me? There is, I won't say it's a fun game, but I think it's a helpful game or a helpful tool called the Five Wishes game. You can look it up online. Some healthcare centers and clinics have it as a tool for their members or their patients. And so it's just a way to kind of break down what are some of these wishes and values that I might have to reflect on in order to make some of these decisions. Talking with our loved ones. This one can be hard because it can be an uncomfortable conversation for some people. It can bring up feelings that are really difficult. And so take your time and be prepared to have more than one conversation. Know that this can elicit an emotional reaction from our loved ones, such as worry, sadness, or anger. So have resources available. Give them the context to the why you're thinking about this or why you want to talk about it. Sometimes for family members, it can create a feeling of, oh, this is morbid. I don't want to talk about it. Or, oh, we're not there yet. We don't have to go there. And so just giving them a little bit of context of, I am thinking, I have a worry, or I have been thinking about this and I want to share this with you. And I wanted to give an example because sometimes I think it's easy to intellectualize what we might say, but it's hard to find the words to bring it up. So, as the person completing the form, I can initiate the conversation with my loved ones. An example, I know this isn't an easy conversation to have, but I would like to share what is important to me when I enter the advanced stages of my disease, or if I'm experiencing a medical emergency and I can't advocate for myself. I have filled out an advanced care directive, and this is the approach that I used when talking to my husband about it. I have a very big family, they are very vocal, and I wanted him to know these are my wishes. You're my person that's going to carry this out if there's an emergency, because I want you to be able to kind of block out some of that noise and remember that I am putting you in charge, and here is the information that I want you to have about what's important to me. But as a care partner or spouse or family member, we can also initiate the conversation, and we can put it within the context of joining this webinar today. I participated in the CurePSP webinar where they were talking about healthcare directives, and I've been wondering if you had a medical emergency and were unable to communicate your wishes to me, what would be most important to you? So the conversation isn't we need to fill out an advanced care directive because it's really important and that's what we have to do. It's more starting the conversation. What would be important to you? Have you thought about this? Here's what would be important to me. So that's really just the first step. And when I talk about consider your values, I remind people that we're reflecting on what's important to us. What are our personal and spiritual values in terms of how we interact with our world and what is important to us? So what brings you joy? What matters most in life? Because that will help give us some clues as to the types of interventions we would want. Because some interventions could have impacts on our ability to interact with our world. And most advanced healthcare directives will have a space where we talk a little bit about end of life planning. And so it does go into what would you prefer if you were in the last days of your life? Would you want to be at home? Would you want to be in the hospital? Do you have an experience with hospice? Do we know what that is? And so, again, it really is just to initiate and to consider and to reflect. What we decide today might not be how we feel in 2 years or 5 years, which is why it's important to kind of reevaluate our directive to see if it still resonates with us and if it still feels kind of true to what's important to us. Something that's really important that is unique to people living with a progressive neurological disorder is thinking through progression and how that impacts our decision making and how that impacts the needs that we may have over time. And so, some really important questions to ask is who in my family or community can help me when I am needing more help in the home? What would that look like? Who do I live close to? Who are my support people? What home modifications should I consider to maintain my safety throughout my disease journey? Again, this is about planning. And so it's about thinking through if I have a two-story home and all my living space is on the second floor, are there things that I need to modify and what would that look like? And what community resources are available to me and how do I access them? Are they local? Are they regional? Are they national? And so it's important to kind of think through who can help me figure some of these things out. If I'm a renter and maybe I can't modify my home, what other ways do I modify without changing the structure of where I'm living? And so these kinds of questions are really in preparation. And just, I always remind my families it's important to know who the key community resources are locally, regionally, and even nationally so that you can access them before you're in a crisis situation. So you know who does what and how to initiate that relationship with that resource. And so I like to give just a visual of what an advanced healthcare directive can look like. And there's one in particular that I use that's from the website Prepare for Your Care. And I like it because it has visuals, because it's very clear, and because it also includes some of the questions that allow people to reflect on their values. And so I encourage people to visit that website. Mine on here says California because that's where I am calling or coming in from, but there's a drop down menu where you can choose your state because there might be some differences state to state. But the big two main elements of an advanced directive, the first is the living well. So it's thinking about starting or stopping life support or medical treatments such as CPR, breathing machine, or ventilator. And this is a part of the advanced healthcare directive that's important to work with your provider with your medical provider with. That can be a nurse, that can be your primary care physician, that can be your neurologist or your movement disorder specialist. But it really is important to ask questions of what exactly do these interventions, what do they actually look like? Because what I've learned over the last few years that I've worked in a neuropalliative clinic is what I thought CPR is based on TV shows that I've seen or even things that I've read isn't really how it pans out in real life and isn't the same perspective that a medical provider might have regarding CPR. So, depending on our health status, might help determine or give us clues as to whether CPR would be helpful or harmful to us. But that really is a question that I recommend if there's one part of your advanced healthcare directive that you explore with your medical provider is this. It's this part. The second element is the element that you all can complete today. So it's designating a durable power of attorney for healthcare decisions. And my hope isn't that you just designate them, but that you document them because it can get tricky for us on this side when working in a clinic. When there's an emergency situation, we might have an emergency contact, but maybe that person is not designated as a durable power of attorney. So maybe they don't have the decision making capacity that we need in order to help and support our patient. Because your medical decision maker can make healthcare decisions for you if you're not able to make them yourself. And so I remind people to reflect on who in my support system would be the best medical decision maker. And that can be a family member, and it can also be a friend. The person has to be an adult, so they have to be over the age of 18. And it should be someone where it's a little bit easier to talk about this with, to talk about your wishes with. Because if the person who you're designating as your durable power of attorney doesn't want to talk about it, then maybe they're not ready to play that role. This person really needs to be someone that can be there for you when you need them. So when I was designating my durable power of attorney, I have a brother in New York. But that probably doesn't make sense to be on the West Coast in California and have my DPOA across the country. Because if there's an emergency, I need that person to be there for me in that moment. And hopefully, at least in the same location where they can be at the hospital and can easily communicate for me. It's somebody who we're going to trust to follow our wishes and do what's best for me. And that can be tricky because in an acute emergency medical situation, the people who love us want us to be around no matter what. But I want my durable power of attorney to be able to, in that moment, set aside their wishes for me and really follow through with my wishes that I documented for me. Someone that I'm going to trust with my medical information that's going to have access to all the information about my medical needs. And really key, because I know that navigating the healthcare system can be frustrating and sometimes requires a squeaky wheel, is someone who is not afraid to ask doctors questions and to speak up about our wishes. So someone who feels comfortable saying, hold on, explain to me what this treatment is so that I have a better idea of what decision I'm making here for my loved one. And just a reminder that legally your decision maker cannot be your doctor or someone who works in the clinic. So if a patient wants me to be their healthcare decision or their durable power of attorney, that's not a role that I could play unless that was my family member. And again, each state may differ with their advanced care directive process. So I remind people utilize a trusted source of information to identify any requirements in your region. And that can be if you have a social worker in your clinic, um, asking that person to kind of support you in navigating making these decisions and finding good information. That can be deciding to accept that referral to a palliative care clinic if that's been offered to you. Because a palliative care clinic and a palliative care physician has a team that really is well versed in some of these decisions and can really take their time to talk you through each decision that you need to make and to answer those, medical related questions of, if I choose this intervention, what can be some of the side effects of that, or what could I expect after that? Would I be back at baseline, or would there be some changes to, my cognition or to my mobility? Community health agencies and local or state government agencies, a lot of times the Office of Aging or these other entities really put time and effort into supporting people in creating these advanced directives and have different workshops that people can go to and have access to individuals who can walk them through. And a lot of times, for an advanced directive, you don't need an attorney to help you create it. You do have to have it witnessed or have a notary sign it off. A lot of people, when they complete their estate planning, they kind of throw the advanced care directive in that whole process. And so you might already have one if you've done estate planning. So it's really just a matter of figuring out what makes the most sense to me, what resources do I have access to, and how do I utilize those resources to document these really important decisions. And I remind people that community and building community is really important, even when we are working through documenting our healthcare decisions. We need support. We need to understand the information or the decisions that we're making, and to have information. And that can come from our medical providers. I also always encourage people to join support groups, hear what other people are choosing to do, or how their process went, or how they talk to their loved ones about documenting their wishes. There a lot of us may have family members who feel comfortable having this conversation, who allow us that space to explore some of the worries that we might be working through, and who can be there for us in that moment of wanting to explore these decisions. Friends, I say never underestimate the power of a really good friend. Sometimes for family, it can be really uncomfortable to talk about these decisions. So maybe we test it out with a good friend and kind of work through how we want to present it with them before we present it to our family. Working with a social worker or psychologist or a therapist, I know that a big reason why we avoid um, documenting our healthcare decisions or thinking about end of life planning is because it can bring up some scary feelings for us. Some existential distress is what we call it, right? Some worries about, well, what is that going to look like for me? And so having that support of a mental health therapist or psychologist to kind of talk through what those worries are can eliminate some of those barriers to documenting. And, I think it's really important to also utilize our spiritual resources, whether you're part of Bible study or church group, clergy, priest. And I do have patients who say, I have a complicated relationship with my religion that I grew up with, and I'm just now exploring kind of what spirituality means to me. That's when you can have access to a chaplain who is non-denominational, most of the time, and who can really explore what spirituality, or help you explore what spirituality means to you, so that if that has been a barrier to documenting these decisions, that's again something that you can work through one of these really great resources. I remind people, we're here, we're sharing information. I'm going to be available for questions to talk through any questions that you have. But there's a lot of good information out there. And sometimes, not that we forget, but sometimes it's hard to, because there's so much information, it's hard to narrow it down to what are the websites that I can go to that can support me with understanding these decisions that I need to make. CurePSP, I always recommend my families to go to that website, to explore it, to get to know the resources they have, and to kind of read the different articles and have access to the different webinars that they put on there, and then prepare for your care. That's where I always recommend my families to go when we're initiating this process of documenting our advance directive. And again, I like it because it's not just, download the form and, have a good day, fill it out. It really breaks down the different areas of the directive. It gives a lot of space for people to fill in and kind of think through what's important to them. And it also gives tips of things, questions that you can reflect on. So I just think it's a really helpful website. And I've even given it to people because they have the documents in so many different languages. I've even given it to people who live out of the country because maybe they can't document their wishes on that specific document, but there's so many great tools and resources on the website in different languages that they can at least get an idea of the types of decisions that they're going to make. And the National Institute on Aging, a lot of the information about kind of the step by step way to start this process, I got from the National Institute on Aging's website because they really also break down advanced care planning, why it's important. And it's even helpful to share some of these resources, maybe with family members who are reluctant to have this conversation, just so they get, again, an understanding of where you're coming from. I'm not trying to overly worry or kind of be morbid and talk about death, which is what some people sometimes think. I'm just trying to think about my future and what I want you to know about my wishes. And so I come back to kind of this step by step guide because we're in the initiate the conversation space. And I hope that after today, you can utilize some of these resources to consider your values and to uh, one step to document your healthcare durable power of attorney. That for me is a really important first step. Everything else will kind of come after that because all the other decisions that you need to make really require a little bit more time and a little bit more digging into what's important. And don't forget that the one of the most important parts of the directive is that your medical team have access to it. And so a lot of times I meet with families and they have a directive, but we don't have it in their medical record. So if there's an acute emergency situation, it's hard to, in that moment, figure out, okay, where is it? What does it look like? And where do we go from here? So that's an important piece once you're all wrapped up with it. So my key takeaways are, step by step, take your time. Don't feel pressure that you have to go home and you have to complete it today. It really is just taking the time to learn, to take it in, to think through what's important to you, to explore with your doctor, what can I expect? I call it peeking around the corner. So a lot of times people newly diagnosed will kind of go all in online and read all the scary stuff. And that's not helpful. So I say kind of rein it back a little bit. And what if we just peek around the corner to, a couple of steps ahead and what that may look like and what decisions you may have to make. And again, at any point we can change what we have outlined in our directive. Ask questions. Don't be afraid to ask. If in my current health condition, if my heart were to stop and I got CPR, what would that look like if I was resuscitated? Would that have to include a ventilator? Those are great questions to ask your medical provider so that you're making an informed decision. Share the information, check in with that friend first and see how it lands, and talk through with your family what's important to you. Let that person who is your durable power of attorney know. Don't just bring it on them like, oh, I decided you're going to be that person. Have a conversation. Are you comfortable with that role? Is there anything that worries you about being my durable power of attorney? And lean on your community. If this is hard, if printed the form out and already designated your person, but it's been 6 months and it's still there on the side table and you haven't touched it, maybe lean on your community and get and help build your insight of, okay, why is this hard for me? What's coming up for me? What's the challenge? And no shame, no blame, no judgment. It's always just about curiosity, kind of leaning in and figuring out, why is this hard for me? What is it that I'm worried about? And how do I take that worry and make a plan for it? That's me. I definitely want to hear questions and have more of a conversation about this. So I'm happy to um, be part of the Q&A.
Adriana, that is such wonderful and helpful information. I mean, so many good points. And things that particularly jumped out at me are you started out with how this is values based and reflecting on your values and defining for your own self what medical care looks like for you and what you want that to look like for you, and how you define comfort and how you define dignity and life with dignity and death with dignity. And I think that's really what's at the core of these tools and these conversations. I also love that you talked about learning what, even though it's sometimes hard, but information is critical. Learning about what some of these medical interventions actually look like realistically and specifically for you, because they look different on someone who might be in their 50s, 60s, 70s, 80s and might have chronic health conditions compared to a 20-year-old, who's healthy and will we see in the media. And also, so much of this, like you said, is ultimately about who you trust to make the decisions on your behalf, based on your wishes. I also really loved the very tangible tip that you provided on bringing this up in a support group and seeing how others approach this. I think there's so much value in knowing you're not alone in some of these tough decisions and getting tips from other people on what worked and didn't work. And how you ended it too, with approaching this in your own time and without judgment and with openness to it. So, I mean, that's all wonderful advice for our community. Thank you. Um, I want to start. So I'm looking at some of the questions that were shared in the comments, as well as the ones that had been provided to us during registration. And I'd love to start out with a kind of a clarification question. So you talked a lot about healthcare power of attorney and living will. But could you explain how a do not resuscitate order, or also kind of going beyond that, it's called different things in different states, but a most or a post or a pulse, here in North Carolina, it's called a most. It stands for medical orders for scope of treatment. How do those kind of advanced care directives fit into or don't fit into healthcare power of attorney and living will? Because we have I hear a lot of confusion around this from my folks around, back when I used to work in the clinic, I'd have people who thought that they had completed a DNR when in fact it was a living will. So clarification would be great.
Yeah, so those are kind of two different forms, because one, the do not resuscitate is for kind of an acute emergency situation. And so the advanced care directive is a guide. It's a guide for our loved ones in a moment where we can't advocate for ourselves. And so I always recommend that people have the Advanced Care Directive, and that gives a lot of space to kind of explore your values and talk about, would you want a feeding tube and those kinds of things. Do not resuscitate, we call it a POLST in California, is a very clear order from your physician on what you do or don't want in the case where if your heart were to stop, and if you want to be resuscitated, and if you do, what treatments you're open to, and if you don't want to be resuscitated and only want, comfort focused treatment. I think the POLST is important, particularly for people who are entering into the advanced stages of the disease, because a lot of times what my families experience is a medical emergency at home and have to call 911. If you have an advanced directive, that is not going to guide your paramedic on what this person wants. It might guide decisions once someone's in the hospital, but in that acute emergency situation, a POLST, which in California is bright pink, and we recommend putting it on the fridge, is a quick snapshot for a paramedic of yes, they want to be resuscitated, or no, they don't. And in that moment, they can make that really clear decision. So where the Advanced Healthcare Directive is a guide for the family, the POLST is a guide for paramedics and emergency medical personnel. And so I always recommend that people, even mid-stage, that they just talk to their provider about that. That one is not something that we can just fill out ourselves. That, at least in California, it is a physician's order. So this is telling the paramedics that this person has spoken to their physician, understands what has made an informed decision about resuscitation, and that's why they feel more comfortable following through that.
Yep, that's a perfect distinction. Thank you so much for clarifying that for our community. Another question that we had received, which I think is an excellent question, is at what point after being diagnosed should I have these conversations and complete advanced healthcare directives?
Well, I work in a palliative care clinic. So my suggestion is always everybody should have an advanced healthcare directive, regardless of their current health status. And so I really learned that kind of early on in my career in medical social work, where none of us are guaranteed getting home that night. And I want my loved ones to know what's important to me. And that is always my suggestion. And so I think anybody who is alive should have their healthcare decisions outlined. If you've been diagnosed with a chronic disease, then that's a good reminder that, okay, this is a good opportunity to either update the one that I completed 15 years ago or 10 years ago, or initiate this conversation and think about what decisions my loved ones might make or might
Yeah,
have to make for me.
yeah, for sure. Something everyone should have regardless, but it's such a good point around when I think that a lot of people, when they're faced with a medical condition, especially if they weren't before, it kind of puts things into focus and makes them think about their values and mortality and morbidity in ways that they did not before. So it is a great reminder and a good time to do it if you hadn't before, or if you had before and kind of revisit that. Um, Another question we had received is, do I really need to complete a healthcare power of attorney and living will if I know that my husband will speak on behalf and I've already told my family what my wishes are?
I think it's still important to document it because in an emergency situation or in a very distressful medical situation, as family members, we might not remember what that conversation was, right? Or we might be in such distress that it's hard to make a decision. Or it's hard to kind of think through, what would my loved one want in this moment? So having the directive is good reminders because it's in our own voice, the person who filled it out, and it's that reminder to our loved one, like, yes, this is I completed this willingly and openly and with and as informed as possible in the case that we were faced with this situation. And it also clearly documents family. I always tell my families, having family is a beautiful thing. It can also make things a little bit challenging because there might always be that one family member who is not in agreement with the decisions that are being made because out of, their own love or fear of losing the person that they care about. So if it's documented and it's clear, it just makes all of that a little bit easier to navigate for the person that you have designated.
Yeah. It takes that weight off of that family as much because that's already laid out there. And to add to that too, even though this is primarily a tool for families, you document it with your primary healthcare providers. So for these diseases, it might be your primary care doctor and your neurologist or the hospital where you're likely to go. And so it kind of lets them know as well and puts everyone on the same page with those wishes. um, Even if they know to turn to your partner or whoever comes with you to your appointments, but they're probably going to be your power of attorney, but it really solidifies that for them.
Mhm.
Um, Someone wrote in the comments here, can a power of attorney make an advanced directive for their loved one with PSP, CBD, or MSA? And then added, because the loved one can no longer speak or sign their name, but they previously made their wishes known. And power of attorney is part of advanced care directives. So perhaps they're referring to living will or the physician orders. But, I think it's still a great question about who has the ability to complete these forms, especially with these diagnoses, because if someone has more difficulty communicating, whether it's cognitively or speech wise or both, the more significant those symptoms are, the harder it is to express wishes. And so, at what point can you not complete these advanced care directives anymore? Too, I think, is also part of that question.
It gets really gray is is what I'll say about that. But if the person has already designated somebody as their healthcare power of attorney, they have given you that permission to speak on their behalf. And so, in a medical visit, if your physician is supporting you with completing a POLST form, then that healthcare power of attorney does have the ability to sign that POLST and, in conjunction with their loved one, kind of go through some of those decision making situations. So, yes, documenting kind of the entire healthcare directive, I think that gets tricky for me. I'm not quite clear if a healthcare power of attorney would be able to go through all of those forms for somebody. But if it's already been documented, then likely they can. But that's really when I recommend even palliative care because those are conversations and having kind of an outside provider talking through and involving still the patient, even though there's communication challenges, is going to be helpful to kind of walk through that little gray area together.
Yeah. And I'm glad that you said palliative care because someone in the comments wrote, my husband and I have done most of what you've discussed. He's in year 6 post diagnosis of MSA. Would it be appropriate to bring palliative care into the picture now? And I know that's not exactly what we're talking about today. And I'll also let everyone else know that I am planning on bringing a palliative care specialist in for one of these webinars as I plan this next year. So we'll get into it more there. But how do these directives and these conversations fit into palliative care, I think is, I'd love for you to address that.
Yeah, so with palliative care, what our goal is to be an extra layer of support to our families. And in some situations, it is navigating the healthcare decision-making process and supporting families in making those decisions. For families who maybe have already done that and they feel really comfortable in the decisions that they've made, one way in which palliative care can be supportive is kind of talking through those decisions and really talking about the decisions that you made a couple years ago. Do they still apply to now? And I think palliative care, particularly for people kind of living with a progressive disease, can really support patients and their families and talking really frankly about what they can expect in the future, what that might look like. And to do that kind of peek around the corner that I mentioned earlier, and to do it in a way that's supportive, that isn't rushed, and that is going to allow people to really talk through some of the worries that they might have so that a plan can be put in place. And to also talk about things like, is hospice something that I'm interested in? Do I have experience with hospice? What would that look like for somebody with my condition? And so, again, I think what palliative care can do is support people in accessing information and make it so that it's tailored to their current condition and their particular condition. Because in palliative care, what we find really important is getting to know the person. So we're very person centered, so that as families have to make these decisions, we can give recommendations based on what we've learned already about the patient, based on what the patient has told us is important to them and the family has told us is important to them. So I think that's why palliative care, and particularly neuro palliative care, can be helpful to families. That we're going to get to know you, we're going to really support you in having difficult conversations, even if you've already documented your wishes, and to work through any worries or anxieties you have about the future, and to help create a plan to kind of minimize some of that anxiety.
Yeah, that's great. Thank you. Along those lines, and I'll start by saying that, as you know, it is a pretty rare setup to have a palliative care clinic or a palliative care specialist embedded within a neurology setting. A lot of people don't have access to that in their areas. And so a question that, with that in mind, a question that we had received during registration is, how do I enlist my healthcare team in help with completing advanced care directives? Is it best to discuss this with my neurologist or primary care doctor, or both? Or should we wait until my dad is using palliative care? And related, another person had also said that they expected their neurologist to bring this up with them, but they never did. So what does
Yeah,
that look
it
like if you
is.
don't have a neuropalliative care
Yeah,
specialist on your team?
it can be tricky. Like I mentioned, this isn't a topic that people just, that's really easy for people to talk about, and that includes medical professionals. I think for a lot of providers, they fear that if they bring this up, it's going to give the message to the family or to the patient that there's no hope and that we're already jumping to, end of life. And so it's been a slow process to support different medical providers to feel comfort in having these conversations. And unfortunately, sometimes as the patient, we do have to be, or the family members, the ones who broach the conversation. And I would say, kind of start with the medical provider that you feel most connected with, that maybe you feel has known you the longest, or that you feel comfortable bringing this up, or you're not going to feel like they're going to be rushed. Or you can even, if you feel comfortable, really comfortable with your movement disorder specialist or your neurologist, send them a message that, hey, I have an appointment coming up in a couple months, and I want to make sure we reserve 10 minutes to talk about my advanced care directive because I have some questions. I went to a webinar back in September and I have some questions I wanted to ask you. So make sure, the biggest worry that my doctors bring up to me is I'm worried that I'm not going to have enough time to really answer their questions. But if they know ahead of time when they walk into the room that you would like to reserve part of your appointment to some specific questions, then that could be helpful. And I would encourage people to think about, instead of saying, I want to talk about advanced care directives, really being clear about, I want to talk about the difference between, do not resuscitate and resuscitation and what that would mean for me and my condition, what your experience is with that. So just have very direct questions that your provider can answer in that moment. And kind of like we talked about, be patient. It might take a couple of conversations, or you might have more questions. And really, there isn't one doctor that I would say this is who you have to talk to this about, but starting with who you're most comfortable with would be a kind of a good first step to bringing them into this conversation.
Yeah. Yeah. That's great advice. Thank you. Knowing that we only have a few minutes left, because I do want to save the last couple of minutes just for some announcements before I let you all go. One person in the comments wrote, "What is the difference between a healthcare power of attorney and a regular power of attorney?" We do sometimes hear those used interchangeably, and there's confusion around that versus financial power of attorney. So clarifying that.
Yeah, so there's kind of the big global power of attorney, and there's even like springing power of attorney, and there's all different kinds of forms. Today, we're specifically talking about this person is only the power of attorney for my healthcare decisions. So they're my emergency contact for my doctors. So this is the person that if I am in an acute emergency situation and they have to do, involved medical interventions, Adriana is the healthcare power of attorney. She's going to make that decision. The financial power of attorney could be a different person. And that person is the one who can, handle finances and that kind of stuff. They can be the same person, they can be a different person, but most of the time it is going to be broken down. Whether you did power of attorney through estate planning, that's going to be broken down. So in your advanced healthcare directive, you can only designate your healthcare power of attorney. The other types of power of attorney over your estate, those are usually something that have to be done through an attorney and kind of have a couple more, dotted I's and crossed T's than your healthcare power of attorney. So that's why I feel like this one area, this healthcare power of attorney, is one little homework that I think is easy to do that we can do on our own without an attorney. And it really is just about our healthcare decisions and a decision maker for our health.
Yep, exactly. Thank you. Okay. I have a few kind of logistical quick questions for you that we had received during registration. So the first one is, where is the best place to keep copies of advanced care directive documents?
So the documents are pretty big. So I would keep them with important medical paperwork. Most important for me is give it to your doctor so it can be in your electronic medical record. Again, your advanced healthcare directive, you want it somewhere handy where you know where you're going to put it. It's not going to be so helpful in a 911 emergency situation. That's why we recommend the Post in that situation. But it will be helpful if your loved one or if you yourself as a person is in the hospital and interventions or decisions have to be made about medical interventions.
Yeah. And I will add the number of people I've had over the years who keep it in a safety deposit box in their bank, which is fine for a copy, but definitely, hard to access in the situations that you need it because you have to go there and what if they're closed and that kind of thing. So somewhere handy and easily accessible, I think, is great advice. And it, making sure someone knows the location of that as well in your house. Along those lines, someone just wrote in the chat, it's important to carry a copy of the DNR, or I guess, is it important to carry a copy of the DNR or similar medical order with you in case of an unexpected situation when you're away from home?
I think if somebody's very clearly DNR and are in mid to advancing stage of their disease, then it would probably be helpful if you are traveling or you're out of town or you're kind of out and about to have it handy. If you're not DNR and you would want CPR and all those interventions, that's automatic. That's what a paramedic is going to do, every time for somebody if there's no form. So if that's you and you want all the interventions, then then you don't have to carry it around. But for people who are in the advanced stages and they really don't want to be resuscitated and don't want to be ventilated and don't want to, have to end up in the ICU, then it could be helpful to have a copy of that if you're traveling or out of town and not at home. But usually when people are DNR, they're a little bit more homebound, and so it's kind of less of an issue.
Yeah. One more logistical question. How often should we revisit the documents once we've created them to make sure that the wishes we wrote out are still accurate?
Yeah, so we recommend whenever there is a change in our health status, that is a good time to reevaluate. And for in my case where I filled mine out maybe 6 or 7 years ago, it might be a good time for me to just revisit and make sure I still feel the same, especially kind of coming or not coming out of the pandemic, but having lived through these last couple years, it has brought some different thoughts to my mind. But if you're experiencing a change in your health status, if you're experiencing more symptoms, if you've had a few more falls in the last 6 months than you did previously, then it's probably a good time to look over your directives or to reinitiate the conversation.
Yeah, great advice. Okay, last question. Um, and this is actually from the comments as well. There was one person in the comments who brought up the word healing multiple times. It sounds like healing is a really important value for this person. And of course, we know that people define healing in different ways, and we don't really know how this person is defining it. But I'm wondering if you could speak briefly to your experience with what healing could look like in this context as people go through the process of completing advanced healthcare directives.
Yeah, when I think of healing, I think of really kind of surrendering to what might be around the corner for us. And so, in the context of navigating healthcare decisions or even working in palliative care, a lot of the healing that takes place is making decisions, really difficult decisions that maybe we don't want to look at or don't want to think about, and giving ourselves permission to grieve, to say out loud the losses that we're experiencing due to this disease, and to um, heal even like the relationships around us, to be able to have honest and frank conversations with our support system about what we're worried about and what they're worried about. So I think it opens up a really beautiful opportunity to talk through what we're worried about and to document what's important so that family feels really solid in that we know what was important to our loved one. We know what quality of life meant to them and what quality of death is going to mean to them because we had these conversations early on as a family. So even if it's a rough start, I encourage people to embrace that a little bit and kind of see where it takes you, because it can take you to a place that you didn't expect.
Yeah, that's a perfect note to end on, and wonderful thought and advice there, Adriana. Adriana, thank you so
Great.
much for taking the time to share your expertise on advanced care directives and answer a lot of questions. We got to a lot of them from our community. And thank you to all of you who are watching and interacting and submitting questions. If we were not able to get to your question today, we encourage you to email us at info@curepsp.org, and we'll do our best to get you an answer or connect you with the right resource from there. I would love to keep everyone for just another 2 minutes because I have a few exciting and important announcements before I let you all go for your day. Our Hope as Big as Texas fundraiser is coming up next Thursday, September 15th. This is a virtual fundraiser for the CurePSP Quality of Life Fund, which allows us to provide been talking too long, allows us to provide grants for 60 hours of professional in-home respite care to families caring for someone with PSP, CBD, or MSA. The event also recognizes and will be celebrating National Hispanic Heritage Month as well as Hope. And Adriana is actually hosting one of the mix and mingle tables for Hope as Big as Texas. So I know she'd love to get to meet some of y'all. Also, the CurePSP Fall Family Conference will be on Monday, November 14th. We are returning to in-person for that one, folks. So it'll be in Philadelphia, Pennsylvania, in collaboration with the CurePSP Center of Care at the University of Pennsylvania. For those of you who cannot attend in person, we will be recording the event and hosting a virtual component of it as well. And that will be offered in 2 parts on December 9th and on December 16th. So more details on those and the registrations will be up within the next about week or so on our website. So look out for that. Our next Ask the Expert webinar, like this one, will be on Monday, December 12th. We'll be joined by Dr. Travis Turner, neuropsychologist at the CurePSP Center of Care at the Medical University of South Carolina. And I've asked him to discuss assessing cognitive changes in PSP, CBD, and MSA. So save the date and stay tuned for more information on that. You'll be able to find information on all of those and all of our events by scrolling down to the events calendar on our website, curepsp.org. And another announcement I want to share with everyone who's still here is we're working hard. We've been working really hard to update, improve, and expand our catalog of printed educational resources for you. And our updated Some Answers booklets for all 3 diagnoses, as well as the newly updated Brain Donation Assistance Program packet, are now available on our website to download and to order. You can find those by visiting psp.org/I need support/resources or by emailing info@curepsp.org. Again, like I said, today's webinar will be archived for later viewing very soon. Please check out our YouTube channel to view previous webinars as well as other educational content, including a webinar that we did just last week called Community Conversations, where I interviewed a young man about his experience of caring for his mother who had PSP. Lastly, and as always, we're able to offer these webinars and all of our programs and resources because of generous donations. So thank you all for your support of CurePSP's mission to raise awareness, build community, improve care, and find a cure for PSP, CBD, and MSA. Adriana, thank you again. Always love getting to work with you. Please take care, and everyone have a great rest of your day.